So what is it like to be a nurse during the pandemic? Anyways, I want to talk a little bit about life living in the time of Corona. Okay, my hair is really weird. Hi everyone, this is 𝐓𝐢𝐻𝐿 and I am making this vlog today because I kind of wanted to document life during the pandemic. If you guys been watching my 1-minute vlogs before on this channel or any of my vlogs, you know that I am actually a nurse here in California, and it's what is today? Today is April 15, 2020, and it is actually about a little bit more than a month, or about a month since we were placed under shelter in place, safe at home / lockdown / quarantine. Currently, it's, I don't know, honestly, it's kind of scary. My unit got turned into the dedicated COVID unit.
So this is how it is now, coming home from work, taking off everything in the garage, and just spraying the heck out of my shoes with bleach.
At my hospital, and about close to a month ago-ish, and because I work in a post-operative floor, they canceled all of the elective surgeries or non-emergency surgery.
There's also Gonyan, trying not to touch anything till I've disinfected myself. Now I'm bringing everything to work in bags that can be easily wiped down with disinfecting wipes, and I throw all of my scrubs into the laundry just to get it clean.
Means that everybody there is either getting tested for the coronavirus, or they've tested positive and they need medical help like oxygen, or they have underlying conditions that require them to be in the hospital. Like mild symptoms of the coronavirus, but more of like more severe symptoms, but not to a point that they need to be in the ICU, that they need to be in a ventilator, or they need help breathing. It's just they need like oxygen, and to get managed for other issues, like if they have diabetes, if they had heart disease, or any other medical issues that kind of put them at a higher risk. Right now, it's kind of like weird because I am on call. I like to say it's kind of like the calm before the storm, and it's kind of very scary, I guess, to say, because it's uncertain whether there is going to be a surge, if there's going to big like surge in the number of patients. Currently, they're kind of flexing and putting some nurses to not come into work because we don't have that much patients right now in the COVID unit, as well as the regular units on my hospital. Anyways, I want to talk a little bit about life living in the time of Corona. As with everybody, I am staying at home when I'm not going to work. I'm actually usually just at home. I've taken a lot of time to like get into projects that I didn't get to before. Kind of like I've taken a liking into sewing, so I've kind of been relearning at that. I've kind of been bad at sewing from the start. I'm like a very just like beginner level, because there is now a recommendation by the CDC to actually wear a cloth mask when you're going outside in the public for essentials. So I've kind of been making them out of my scrap fabrics, fabrics that I have had already before, into cloth masks. And because I'm a beginner, it's kind of like the really most basic, kind of just right above no-sew type of mask. Also been learning how to make a bouffant cap, which is like usually used in the operating room, but it's used to cover your hair and keep hair from going to a pig.
So I take a hair tie, kind of make my hair and put it in a bun, kind of like a messy bun. Yeah, and then I take my cap. This is the one I actually sewed recently. It actually came out okay. It has red pandas and it looks pretty cute. Hopefully it makes me look cute too at work, hopefully. And I tied it back so it's pretty secure and it wouldn't fly off. And then I check my glasses, fix my glasses, and that's it.
So what is it like to be a nurse during the pandemic? It takes a lot of, like, I guess just mentally and emotionally. I know all over the news you kind of hear that the COVID-19 doesn't pick like who it infects. Like, it's a virus, and once it finds a host, if your immune system's not able to fight it, then you're very likely to have either mild or even severe symptoms that you would need to be in the hospital. It is very scary to be on the front line as a nurse because every day in the hospital we're kind of more exposed to everything, not just COVID-19, and we're kind of more nurses and doctors and healthcare workers are more susceptible to getting it. I actually have like seasonal allergies, so it's kind of hard to like kind of not freak out every time coming from work and being like having like a sniffle or like a little bit of a cough, a dry throat, and be like, oh my god, I have COVID-19. In my hospital, we've been rotated between the COVID floor, the other medical surgical units, the regular floors. But in the past month, since we started doing that, I've actually, I wouldn't say volunteer, but I kind of been telling them that I actually prefer to work in the COVID floor. There's a lot of reasons, mostly because I feel like as a nurse, like I have that duty and I swore an oath to help people. And if there is a pandemic, I kind of want to try my best to be in the front line of that, even though I'm really scared of getting COVID-19. I really want to try my best to take care of those people who have coronavirus, even though it's actually really hard because we have to go in there full suit in our PPEs with everything, and it's really hard to breathe because you have to wear a respirator and N95, which by now everybody knows what an N95 is. So you have that, you have like another layer of a mask to help preserve the N95 because we only get one per shift for all our patients, like compared to before that you just throw those away when we didn't have a shortage of N95s. And then you have to put a full-on like isolation gown, you put a cover on your hair, your shoes, you pretty much try to cover everything, gloves, and like a face shield. So it's so much harder to take care of patients because we have to go in there constantly to check how they are, how their breathing is, if they're doing okay, if they need any help, to give them medications. It's definitely challenging, but so that was the main reason. I really wanted to be in the front lines and being able to kind of fulfill that duty that I have as a nurse for like about 10 years now. So even though it does kind of make me very anxious and scared every time I come into work. Second of all, it's also because I actually come from a long, like almost my entire family, immediate and extended family, are nurses. Just between me and my siblings, out of 6 of us, there's actually 4 of us that are nurses that are in the front lines. So I kind of joke that being the youngest, I would get teased mercilessly by my older brothers and my older sister if I actually like cowardly back away from taking care of coronavirus. As the forever bunso, or the youngest, I'm always kind of like, okay, have to go in there and be brave. Third reason is because I really feel like I have this, like, just being a human being, like we're all kind of called into these strange times right now with the pandemic going on, and we've all had to adjust to a new normal. I think just for me, I just want to be able to look back on this years from now. I want to be able to look back, hopefully a year or two from now, and be able to look back at this vlog and be like, I did everything I can as a human being, as a nurse, as a healthcare professional to fight this pandemic. What else about life about the pandemic? It's kind of crazy. I guess sort of faring better just because I'm still going to work. You know how people are saying nowadays, it's like you're not stuck at home, you're safe at home, which is totally true. Please, 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 if you don't need to be out in the public, please stay at home right now. Because that's helping us, the essential workers or the healthcare workers that have to go out there every day, battling and facing this virus head on. It's helping us because it's, you know, if you're safe at home, then the virus doesn't have a host to infect and to like spread. I don't feel it. I don't feel the pandemic, I guess, in the same way as other people because I'm not home all the time. It's just a little bit different because I'm going to work, putting myself at risk, but also I'm privileged enough to be having that like opportunity to be actually out and not be at home and like really having cabin fever. Definitely take this time to be kind to people because that's what we need to do these days in the pandemic. We don't know how long exactly this is gonna go on. So distancing, which is just really actually more like physical distancing, just stay at home. For me, it's just me and my sister living in our house. So we kind of also sort of do social distancing even at home because I'm regularly exposed to COVID-19. She is as well because she is a nurse as well. So we're kind of like also just watching each other, and actually checked up on my friends via text, FaceTime, calls, so much more than I usually do because normally I'd be so busy and I don't really have time to answer text messages to friends, and they're also, a lot of my friends are also frontliners. Those group of friends, I've actually texted and talked to them a lot more and checked up on them a lot more since the pandemic. Honestly guys, wash your hands with soap and water. Sing the happy birthday song 20 seconds as everybody keeps on saying, but just wash your hands like crazy. Like my hands are really like dry, just to keep my hands on like sort of human-like and not gross. What else do I want to document today? Yeah, there's a lot of Netflix going on days off aside from sewing and getting back into that. Catching up on Korean dramas that I haven't had the time to watch, and just basically trying to keep sane and not like go crazy at home. Of just getting enough rest and getting enough sleep. Normally before the pandemic, I would actually get like probably 3 or 4 hours of sleep, a little bit less if I'm going to work that night, like today. But lately I've been sleeping a lot just because sleep works really well for your immune system, and I really need my immune system to be like top notch, ready to go, ready for battle these days with the pandemic, because when you're out there like being exposed to COVID-19 at work a lot, you want your immune system to be able to fight it and be like the best soldiers it can be for your body. So yeah, I think that's pretty much it for today. Yeah, I don't know what else I need to do for a vlog. It's been a while.
Hey, so that was the end of this vlog, and here's me walking over with my mask on, just on my street. I'm actually just walking to mailbox. But like and subscribe. Hopefully there's going to be more vlogs soon, and maybe I'll document more about life in this strange times of corona, in this pandemic. But see you guys soon.